Many years ago, we noticed that children on the ketogenic diet were often very sensitive if they were exposed to extra carbohydrates, and they would have an increase in seizures. We also noticed that while on the ketogenic diet, children's blood glucose or sugar level was incredibly stable. Whether they were eating or not eating was incredibly stable throughout the day. So we started wondering if maybe that stabilization of blood sugar was one of the ways the ketogenic diet worked. And so we thought, was there a way we could approximate that stabilization of blood sugar in a less restrictive way? And that made us start thinking about the glycemic index of foods, which is how much a food will cause your blood sugar to increase after you eat it, and wondered if we used low glycemic foods and carbohydrates, could that kind of come close to, instead of the typical American diet with the increase and decrease of blood glucose during the day, could it more approximate what the ketogenic diet was doing? So we developed the diet where we would allow children to have more carbohydrates than they could on the classic ketogenic diet, but those carbohydrates would be with a low glycemic index, meaning they were carbohydrates that wouldn't cause such an increase in blood glucose. And we found that it worked. The first 20 kids we put on the diet, I thought it almost worked too well, because the majority of them had a profound response to the diet. And again, over the past 12 to 14 years we've been using it, had several hundred kids on it. We find, at least in our experience, it's almost effective as the classic ketogenic diet. And I think in many ways, it's an easier diet to implement. It requires less dietitian time and effort. So in a way, it's easier for a program to initiate and follow more people on the low glycemic index treatment than it is the classic ketogenic diet. I also think that for the child or the individual on low glycemic index treatment, it's easier. It's less restrictive. It's more normal. People can go to restaurants and order off menus. They can go to their school and eat the school lunch or components of the school lunch. So I think in a way it helps the person with epilepsy and epilepsy that's tough to treat feel less different and more like a normal person. When people come to us to discuss the possibility of dietary therapy for epilepsy, there are several factors that go into account on which diet we think would be most appropriate. If it's a baby or a child less than 2, we feel pretty strongly that the classic ketogenic diet be used. If it's a person who's exclusively fed via a G-tube and not eating by mouth, we also kind of believe that the classic ketogenic diet is better because there's a formula that can easily initiate the diet. Also for certain metabolic disorders, some mitochondrial disorders and GLUT1, we feel that the classic ketogenic diet is probably the more appropriate diet. Outside of that, anyone over 2, if they first come to us, we initially recommend low glycemic index treatment. Heidi can teach the family that day in the office how to start the diet and implement the diet. And similar to the ketogenic diet, once a person's on low glycemic index treatment, we also do a lot of fine-tuning. So we recommend it. I used to say we recommend it kind of like water at the MGH, but we do recommend it a lot because we find that many families are able to do it. It's not perceived by many as difficult as the classic ketogenic diet, and it's often wicked effective. Had to get wicked in there, right?
Yeah, exactly.